So what I want to do is to provide some context with the workplace violence topic and the issue of workplace violence in healthcare, and provide context in as compared to all other hazards in healthcare that you may face as a healthcare worker. And, the hazards that you will experience on the job will depend on your work environment, whether it's acute care, hospitals, or long-term care, for example. So let's have before we start looking at our physical hazards, I want to note that, and you're probably aware, that the injury rates to nurses and CNAs particularly rose about 240% between 2019 and 2020. And this was to nurses, this impacted nurses and CNAs in acute care and long-term care. And you might think this is because of exposure to COVID, but we also saw a significant increase in injuries related to workplace violence and musculoskeletal disorders. So let's look at our top physical hazards then for healthcare workers. Number one being overexertion musculoskeletal disorders. No surprise if you're a direct care nurse, this is mostly related to manual patient handling. But it's not just nurses and CNAs that suffer from musculoskeletal disorders. It's our EMS workers, our physical therapists, OTs, just to name a few, radiation oncology technicians, home health workers. And when we're talking about overexertion and MSDs, we're also talking about high rates to our support service staff, such as environmental service workers or housekeepers, EVS, from handling trash and linen and the general cleaning duties that they have to perform. There's about 38% of injuries are thought to be reported that are associated with MSDs. Slips, trips, and falls are our number two physical hazard. About 28% of injuries reported are slips, trips, and falls. And then about 13% of injuries reported are due to workplace violence. Now, these statistics were reported prior to COVID. And we have to remember that underreporting is significant in healthcare. So underreporting of all hazards in healthcare, including violence, is estimated to be as much as 50%. So everything that I'm talking about today, when we're talking about data and statistics and the scope of the issue, is really just the tip of the iceberg. And we're really just starting to find out how serious workplace violence is in healthcare. There's a couple of other physical hazards here for you, noise and radiation. But let's look at the second big pot here, which is psychosocial hazards, such as shift work, long hours and overtime, competing demands, bullying, low perceived control of your work, lack of appreciation and support. All of these are psychosocial hazards. And we knew that prior to COVID, these were of a serious concern. And interestingly, these psychosocial hazards are directly related to musculoskeletal disorders and workplace violence, or the rates of those types of injuries. And we'll get into that a little bit later. Obviously, because of the impact of COVID, all of these psychosocial issues are significantly exacerbated. If we think of the exposure to trauma and stress and death and patient suffering that our healthcare workers have dealt with in the last 2 years, you can appreciate what I'm saying here and how serious this is. Some of the other hazards that we're faced with, just to give you an example, no surprise here, bloodborne pathogens, SARS-CoV-2, tuberculosis, and other chemical hazards. This is not an all-inclusive list. But what's interesting is that the top three physical hazards account for nearly 80% of days away from work cases. So this is where a nurse or an aide or another healthcare is injured on the job and they have to have lost time or time away from work. They also account for nearly 80% of the workers' compensation costs. So another way to look at this is if healthcare employers seriously address the top three hazards here, we would make a very big dent in our healthcare workers' safety issues and improve the safety and health of all of our workers across the continuum. I like to think of our healthcare as a high hazard industry, unfortunately. And the reason I say that is because these hazards are not always visible, and that our students in healthcare, nurses, aides, medical assistants, even physicians, physical therapists, OTs, get very little education as students on these hazards. We all learn about bloodborne pathogens and the importance of personal protective equipment, but I can guarantee you very few of them learn about patient handling, how to prevent violence on the job and the psychosocial issues and how to take care of yourself and deal with stress. In addition to that, as nurses particularly, but I think for most healthcare workers, we will always put our patient ahead of our own safety. And an ANA in the Healthy Nurse, Healthy Nation survey, 70% of nurses surveyed said putting the health and safety and wellness of their patients before their own is what they're going to do. There's one other thing to consider. You can't address workplace violence on its own without considering the impact on the whole system. So in other words, we need to address more than workplace violence if we're going to keep healthcare workers safe moving forward and ultimately improve patient safety in healthcare in the US.